Let's start by stating something important, something we don't say enough: your sexuality is ageless. The desire for intimacy, pleasure, and connection with your own body doesn't have an expiration date. It evolves, it changes, but it does not disappear. Yet, as with any physical activity we've enjoyed for decades, the way we approach it needs to adapt. Think of it like exercise. The goal is still to feel good, but your routine at 60 is probably wiser and more mindful than it was at 20. Today, we're here to talk about one of the most fundamental aspects of personal pleasure: masturbation. Specifically, how to do it safely and joyfully after 60 by avoiding 5 common but significant mistakes. Mistake 1. Ignoring physical changes. The most fundamental error one can make is failing to acknowledge and adapt to the body's natural evolution. Attempting to replicate the techniques, pace, and intensity of youth without adjustment is a direct path to discomfort, frustration, and even physical strain. What felt effortless and spontaneous at 30 may now require more time, different stimulation, and a greater focus on comfort. This isn't a sign of declining sexuality, but rather a signal that your approach needs to mature as gracefully as you have. These physical changes are multifaceted. For women, the decline in estrogen during and after menopause often leads to vaginal dryness and a thinning of the vaginal walls, atrophy, making the tissue more delicate and sensitive to friction. For men, it may take longer to become aroused and achieve an erection, and those erections may be less firm than before. Furthermore, common age-related conditions like arthritis in the hands and wrists, joint stiffness, or chronic pain can make certain positions or motions uncomfortable or outright painful. The solution is not to give up, but to innovate. This is an opportunity to become a student of your own body all over again. It means embracing the use of lubricants as essential, not optional. It means exploring different positions, perhaps lying on your side or propping yourself up with pillows, to alleviate pressure on sore joints. It might mean investing in a well-designed sex toy that can provide stimulation without demanding a tight grip or repetitive wrist motion. Adapting isn't about loss, it's about refining your practice for sustained pleasure and comfort for years to come. Mistake 2. Skipping lubrication. Perhaps the most common and easily avoidable mistake is treating lubrication as an optional luxury rather than an absolute necessity. After 60, the body's natural moisture systems often don't function as they once did. For women, hormonal changes significantly reduce natural vaginal lubrication, while for men, the skin can become less elastic and more sensitive. Relying on what the body naturally provides is often a recipe for discomfort, as insufficient lubrication creates painful friction against delicate tissue. This friction is far more than a simple inconvenience. It poses a real risk to physical health. Without adequate slipperiness, the delicate mucosal tissues of the vulva and vagina can develop tiny micro tears. These microscopic abrasions are not only painful, but also serve as open gateways for bacteria, dramatically increasing the risk of infections, including urinary tract infections, UTIs, and bacterial vaginosis. For everyone, chafing and irritation on the penis can cause soreness that lasts for days, turning an act of pleasure into a source of pain. Furthermore, the choice of lubricant matters immensely. Not all products are created equal, and using the wrong one can cause more harm than good. Everyday household products like lotions, oils, or petroleum jelly should be strictly avoided, as they can disrupt the natural pH balance, lead to infections, and damage the delicate ecosystem of the vagina. They can also degrade latex condoms and damage sex toys. It is crucial to use products specifically designed for intimate use. The solution is to embrace high-quality, body-safe lubricants as a central part of your routine. Look for water-based or silicone-based formulas that are free from parabens, glycerin, perfumes, and artificial flavors or warming, cooling sensations, which are common irritants. Water-based lubes are versatile and toy-friendly, while silicone-based options provide a longer, lasting, silkier feel. Making lubrication a non-negotiable first step ensures that pleasure remains safe, comfortable, and intensely enjoyable. Mistake 3. Using unsafe or inappropriate products. One of the most dangerous mistakes stems from a moment of improvisation, reaching for a product not designed for intimate use. This often happens out of convenience, a lack of access to proper products, or simply not understanding the significant risks involved. Household items like moisturizing lotions, massage oils, petroleum jelly, or even cooking oils are formulated for external skin, not for the delicate, absorbent, and pH-sensitive mucosal tissue of the genitals. Using them internally is an invitation for a host of complications. The immediate physical consequences can be severe. These foreign substances can cause allergic reactions, leading to intense itching, redness, and swelling. More insidiously, they disrupt the delicate natural pH balance of the vagina. A healthy vaginal environment is slightly acidic, which helps to keep harmful bacteria in check. Introducing a foreign substance can make the environment more alkaline, creating the perfect conditions for yeast infections and bacterial vaginosis to thrive. For anyone, these products can clog pores and lead to irritation or folliculitis. Beyond creams and oils, a significant risk lies in the improvisation of objects themselves. Using household items as makeshift sex toys is profoundly risky. These objects are not designed with body safety in mind. They can have sharp edges, seams, or porous materials that can harbor bacteria and are impossible to sterilize. Perhaps the greatest danger is the risk of loss or retrieval. Objects not designed for the body can easily get stuck, leading to a painful, embarrassing, and medically urgent trip to the emergency room. This principle of safety also extends to products that are designed for intimacy but are misused or poorly maintained. Sex toys made from porous materials like jelly, PVC, or TPR can leach harmful chemicals and, despite cleaning, harbor bacteria and mold within their microscopic pores. Using a toy without a flared base for anal play, neglecting to clean it thoroughly before and after use, or using an old, degraded toy are all practices that can lead to infection or injury. The solution is to invest in body, safe products from reputable retailers. Look for sex toys made from non-porous, hypoallergenic materials like 100% medical-grade silicone, glass, or stainless steel, which are easy to clean and sterilize. For lubricants, choose only those specifically labeled for intimate use. Proper maintenance is key. Clean toys thoroughly with soap and water, or a dedicated toy cleaner after each use, and store them properly. Viewing these products as investments in your health, rather than frivolous extras, is fundamental to safe practice. Mistake 4. Neglecting underlying health conditions. As we age, our health narratives become more complex, and to ignore this reality during moments of intimacy is to risk serious consequences. The fourth critical mistake is compartmentalizing sexual activity away from your overall physical well-being. Masturbation, while a low-impact activity for most, is still a form of physical exertion that elevates heart rate and blood pressure. For individuals with certain underlying conditions, failing to account for this can be dangerous. Cardiovascular health is paramount. For those with a history of heart disease, hypertension, or who have experienced a stroke or heart attack, the exertion of sexual activity, even solo, must be considered. While the risk of a cardiac event during masturbation is generally low for most, it is not non-existent. The key is to understand your personal capacity. A good rule of thumb, often called the talk test, is that the exertion level should allow you to maintain a conversation. If you are becoming severely short of breath, experiencing chest pain, or feeling dizzy, you must stop immediately. The impact of medication cannot be overstated. Many common prescriptions for age-related conditions can have direct effects on sexual function. Blood pressure medications, antidepressants, and antihistamines are just a few categories that can influence libido, arousal, and the ability to achieve orgasm. Perhaps more dangerously, medications like nitrates for chest pain, angina can have life-threatening interactions with erectile dysfunction drugs like Viagra or Cialis that some men might be using. It is absolutely crucial to understand how your prescriptions interact with sexual activity. Arthritis, osteoporosis, and chronic pain conditions present a different set of challenges. The mistake here is failing to adapt your environment and technique to accommodate physical limitations. Painful joints or concerns about bone density might make certain positions or vigorous motions risky. Ignoring these signals doesn't make you tougher. It risks causing a flare-up of pain or even injury, which can create a negative association with sexual activity altogether. Neurological conditions, such as those resulting from a stroke, diabetes, related neuropathy, or Parkinson's disease, can alter sensation and physical response. The body may not send or receive signals of arousal in the same way it once did. This can be frustrating and may lead to overcompensation with force or pressure in an attempt to feel sensation, which can inadvertently cause tissue damage. Recognizing these changes is the first step toward adapting to them safely. The single most important action you can take to avoid this mistake is open communication with your healthcare provider. It can feel embarrassing, but doctors are professionals who understand that sexual health is integral to overall health. Be direct. Ask, are there any risks with my heart condition? Or, could my medications be affecting my sexual response? Or, what precautions should I take given my arthritis? This conversation provides a personalized safety net. Ultimately, the goal is to practice mindful self-awareness. Listen to your body's signals before, during, and after. Choose a time of day when you feel most rested and free from pain. Create a comfortable, supportive environment with pillows. Start slowly. This mindful approach ensures that the pursuit of pleasure supports your health and well-being rather than working against it. Your body's wisdom is your best guide. The key is to heed its advice. Mistake 5. Succumbing to psychological barriers. The 5th, and in many ways the most profound, mistake is not physical at all, but mental. It is the act of allowing internalized stigma, outdated beliefs, and societal silence to create a barrier between you and your own body's capacity for pleasure. For individuals over 60, these psychological hurdles can be more effective at shutting down sexual expression than any physical ailment. We live in a culture that overwhelmingly equates sexuality with youth. Advertising, media, and popular culture rarely, if ever, depict older adults as sensual, sexual beings. This creates a powerful and damaging narrative that suggests desire and self-pleasure are inappropriate past a certain age. This can lead to a deep-seated feeling that exploring your own body is somehow undignified, shameful, or simply wrong. This external narrative often fuels a potent internal critic. Thoughts like, I'm too old for this, what would my children think? Or, this is pathetic, can arise unbidden, effectively halting arousal and enjoyment. This internalized shame is a pleasure killer. It can cause you to rush the experience, avoid it altogether, or be so trapped in your own head that you cannot be present in your body to feel any sensation. For those who have lost a partner, guilt can be a significant barrier. The act of self-pleasure might feel like a betrayal of a spouse's memory or the intimacy you shared. It's crucial to reframe this thinking. Self-care and self-love are not acts of replacement. They are acts of honoring your own aliveness and your continuing capacity for feeling and joy, even amidst grief. Another common psychological hurdle is the myth of the perfect body. Aging changes our bodies in visible ways, and it's easy to feel disconnected from or even repulsed by a body that no longer looks or functions as it once did. This disconnect can make the idea of touching and exploring your own body feel unappealing. The focus shifts from sensation to criticism, from feeling to judging. Furthermore, a lack of education tailored to seniors leaves many believing that their changing responses are a permanent end to their sex life. Not understanding that it may take longer to become aroused or reach orgasm can be misinterpreted as personal failure or permanent dysfunction. This leads to performance anxiety, even when performing for oneself, which is fundamentally at odds with the relaxation necessary for pleasure. Overcoming these barriers requires a conscious and compassionate process of cognitive reframing. The first step is to grant yourself explicit permission. Your sexuality is your birthright. It does not expire. It is a natural, healthy part of being human for your entire life. There is no expiration date on self-discovery and self-love. Challenging the narrative means actively seeking out positive messages. Read articles and books by experts on senior sexual health. Understand that your changing responses are normal and manageable, not a verdict. Focusing on the sensations you can feel, the touch of a soft blanket, the warmth of water in the shower, the pleasure of a message, can help rebuild the connection between your mind and your body's capacity for enjoyment. Ultimately, cultivating a mindful practice is the antidote. Instead of making orgasm the sole goal, Focus on the entire experience of touch and sensation. Practice self-compassion. Speak to yourself with kindness. Your body has carried you through decades of life. It deserves to be treated not with criticism, but with gratitude and respect. By quieting the critical mind and embracing the wisdom and capabilities of your body as it is today, you open the door to a fulfilling and safe practice of self-love at any age.